All right, so for my presentation, I'll go over my professional philosophy in health education. So, one factor that led me towards health education is my personal belief that the average person deserves to be educated on their health and their community. So, my interest in health education stemmed from experience when I researched COVID-19 and the safety risks associated with opening outdoor parks. When I had my when I had to step in for my community to pressure the mayor and town council to reverse their decision to keep park the park closed as surrounding areas parks opened till the crisis was over. And to me, this would sound like it was built in a fear based instead of a knowledge based thing. And that's what really drew me to it. And I brought this information to the town council meetings. And even after I presented data supporting that outdoor environments were safer than enclosed areas such as schools, I offered them to open the park. And then if they close the schools, then close the parks with them. Uh, and So when the change was still reluctant, I turned to social media and the local web pages and educated the public and refuted any rumors and inaccurate informations. In 2 short months, they removed the plywood from the front of the entrance, and now children have a place to play. Play for children is important. It decreases the risk for developing mental health disorders from remaining indoors and away from social settings. This gives meanings to what I do and what I have done. I see more and more places in rural county opportunities to combat serious issues here, such as mental health, drug and alcohol addiction, obesity, and public health outreach. Education and promotion gave the community the opportunity to make a widespread change to the quantity and quality of life of the people who live here in this area as we were becoming intertwined with technology to assess the information in the palm of anyone's hand. I said we're becoming it's many sources of misleading information and incorrect um, information out there, and that leads to decisions that can be dangerous to one's health. Here, individuals commonly dismiss wearing masks, getting vaccinated, or even keeping distance from others. Sport fields were still packed. County fairs were crowded. 5% of the people were there wore masks. While fair employees wore masks and they cleaned off the rides to make sure the contact was made or it was cleaned, now deemed that contact with surfaces is a very unlikely way of contracting COVID-19. It seems that we do things more because someone's asked us to instead of is it helping? A lot of time and money. So I can't imagine how much time, money, hoarding cleaning supplies was spent trying to prevent infection that we hadn't taken the time to understand on an individual level. And as a professional goal, as a professional, my goal is to provide thorough evidence to guide communities to act with integrity and dedication to bring the community forward, not backwards. My role in health education, I will continue my goal again to run again as mayor and winning a seat in public office so that I can directly impact my community with the proper authority and power. Working with nonprofits in the area, such as the National Alliance for Mental Illness, or NAMI, do outreach and I can provide emotional counseling to members of the community and local health department. Or I could work in Nashville at one of the major healthcare and insurance companies that are eager to hire a MCHES. I'd rather focus on rural communities since they are underfunded, underrepresented, and many are facing many crises as mentioned above. Looking at these areas is becoming more important as communities have begun to grow, with many new people transplanted from the area to avoid the high cost of living, such as Nashville. And as a father of 2 children, focusing on programs for schools, such as having community gardens and increasing physical activity, encourage outdoor recreation, such as hiking through the trails. We have a very beautiful park that's 10 minutes down the road, and it's a wonderful opportunity for kids to get involved in nature. Proper use of safety equipment. Injuries can be easily prevented when wearing helmet and pads when at a skate park. Uh, and even though a sign's up, many of the kids here do not do those things. And I don't want anyone to be hurt. And I also want to ensure that the park equipment is safe and reliable for use. And as noted, I have not I found deteriorated and dangerous equipment, and I've brought those up. And I always do that. I always make sure to bring up things and never let something just bypass me. It gets my full attention, and I go from there. And as always, I want to directly interact with the people on social media. Uh, that's how I feel more comfortable talking to people sometimes, or do telemedicine, telehelp or anything like that to reach out to people who can't, get out of the house to see someone. But either way, research in the community will try to help us try and become the example that others want to follow, solving a problem for what is needed to save rural America from the exodus of people moving to cities to work. In the past, I've gathered data on how far people have to travel to go to work, resulting in I found out people that live here in my town of White Bluff, they have to go about an hour and 20 minutes on average is the commute time to and from work for most people, and that's time that's away from their loved ones, time away from self improvement, time away from cooking a healthy meal, being agitated from stress, from driving congested patterns. The more I research topics like these, it starts to unveil how problems such as mental health began to grow. The goal is to always to learn, teach, and grow. When people start reclaiming their lives from working too much, making better decisions on diet and exercise, communities can heal, in sync, leading, move in sync with leading health information, and becoming part of that health information. So theories exist, and they need to be tested, and more is needed to promote ethical interventions on system and practical levels when it comes to how we address, because we look at it from either a top down, bottom up, uh, any one of those, and that's something that's has twisted my idea of what's the benefit we really can see out of the health educators. What kind of outreach can we really have? Can we make a basic common knowledge, something that we can start at a very young age and instill over time to said heal our community? So at first, the rural areas led the cities, and then now through the cost, they flood back. But in the meantime, we have two generations of loss, and that's it. It speaks a lot when you have to look at that as a community. And for me, I'm not from my community, and it's, it's difficult for me at times, but I do understand. And so, whatever I do professionally, health and education, it will be to strengthen the connection that any educator, anyone who has something to teach, and anyone who has something to learn, that's what the connection's for. So, I'm hoping that so my next moves are going to be pretty awesome. So, I'm done here. I appreciate it. Thanks.